Today, I'm joined by Rohan Pardasani, CEO of Avaana, an Australia-based corporate health and workplace recovery platform. Avaana is building a model that connects two areas that are often treated separately: preventative employee well-being and post-injury recovery. Through a national practitioner network and tech-enabled workflows, the company helps employers give staff faster access to care and helps insurers reduce friction when someone needs treatment after a workplace injury. In this episode, we unpack what that integrated model actually looks like in practice, from employer funded well-being credits to insurer linked care pathways and return to work support. We also talk about why psychosocial health is becoming a bigger priority, what employees actually want from modern workplace health benefits, and why speed, trust, and continuity of care matter so much in the real world. So, if you care about scaling health services into employers, insurers, and institutional channels, this is a useful one. Welcome to the show, Ron.
Thanks for having me, Scott. How are you today?
Absolutely. Yes. Good. Alrighty. So for people hearing about Avaana for the first time, what is the business today and what problem are you solving?
Yeah, Avaana is a workplace health platform where we connect two areas of workplace health that have traditionally been treated separately, specifically preventative health and well-being services, and secondly, injury management and recovery services. What we found is that most organizations have a well-being program on one side, things like EAP, corporate benefits, preventative health strategies such as fit to work programs and pre-employment medicals. And similarly, on the other hand, they have different vendors, different providers who provide injury management related services. These are services that typically kick in once an employee suffers an injury, whether it might be as a result of a physical hazard or a physical injury or a psychosocial hazard or psychosocial experience. And the issue with the traditional characterization of workforce health programs is that employees don't traditionally experience their health in those neat categories. It's really one continuous journey, and it touches on factors that happen at work, such as the support that a workplace may be providing to keep the employee engaged. Similarly, injuries that may occur on the job. But a big factor is also what's happening in the home, so their personal injury journey. And what we've tried to do is address all of those different instances of health support, whether at home or at work, to build a single continuous platform for employees to access both medical and allied health services like doctors, physiotherapists, psychologists, counseling, all the way to other sort of well-being services and fitness services such as exercise, physiology, yoga, massage, and Pilates. Employees can fund preventative care through well-being credits. Injured workers can move into structured recovery pathways, which are also funded by the employer. But there's also an ability for personal financing of services which assist the injured worker. So at least they have their continuous or their whole health picture on the one platform and can access the benefits that their employer is able to access in terms of speed to care if they get injured, but also continuity of care as they've seen sort of the same practitioner across that whole health journey.
So you had previously mentioned the market usually splits into two buckets: the preventative well-being and recovery after injury. So why has that split become a problem?
I think it's always been an issue. It's just that there was really no alternative in terms of how to solve that problem. I think employers have always felt the burden of preventative care being managed typically by HR, corporate benefits typically managed by HR, but then the work health and safety teams, especially at larger enterprises, taking over once a workplace injury happens. Obviously, the payer of the services is different. Sometimes workplace injuries, or usually workplace injuries, move into workers' compensation claims, whereas HR benefits, or rather corporate benefits, are usually self-funded by the employer. And hence why you have, these two buckets. The issue is twofold though for the employee is that there's massive fragmentation. We see businesses who'll have an EAP provider, they'll have corporate benefits, they'll have a fit to work strategy to ensure that their employees can properly do the job. Then from a injury management perspective, they have an early intervention service, medical triage. And then once the service provides or moves to claim, there's a different team managing the post-claim treatment. And what happens at each one of these junctures is that there is a reset. There is a reset where all of that clinical history is either lost altogether, in which case the incoming practitioner needs to do a complete assessment of the employee from a standalone basis without the clinical history from the past, or there's a handover and that handover is manually done and it's usually incomplete and it has gaps. And because that reset occurs a lot, what we lose is momentum when that handover occurs, or if no handover occurs, an assessment reoccurs. And that momentum or that lack of momentum, really protracts the disability period for when a worker can be off work.
So what made you believe those two worlds should be connected instead of treated as separate services?
Well, the real insight for us came from working in both environments. We started by building a booking platform for allied health practitioners and corporate wellbeing programs. But at the same time, or rather slightly after we built the corporate platform, we began working with workers' compensation insurers to manage appointment bookings for injured workers. And what we noticed very quickly was that the same practitioners, the same types of treatment and often the same people were providing those services to employees, but just in different contexts. If I can, highlight an experience for you that a lot of people in your audience may have suffered themselves, an employee might, see a physiotherapist if they have back pain and that back pain has been acute or, is sort of lingered for a long period of time. But if they had a workplace injury, the system would force them to start again and anew with a completely new practitioner who was found by the employer, who had no understanding of, that pre-existing injury and how that might be impacting the employee on a day-to-day basis, and how that history really translates into the future treatment by that new incoming provider. And once we saw that pattern, it kind of became obvious that the world should be connected. If someone already trusts a practitioner and has a clinical history with them, why wouldn't we, leverage that relationship when they need it most, when an acute incident occurs? And that realization has really shaped the whole model.
Okay. And how does the model work in practice on the employer side, especially around, say, well-being credits and employee choice?
Yeah, I think what we've found, especially in the current environment, is that credits are really, compelling proposition. So at its core, our platform thinks of care in with reference to credits. A workforce comes to us with a specific budget in mind across those different kind of areas that we spoke about: preventative, injury management, etc. And that budget converts into credits that employees can use to book real, appointments with allied health practitioners. So instead of spending money, at least on a preventative program that employees may or may not use, that budget goes directly into service people actually value. And when I say people, I mean both the employee and the employer. So we see credits being used pre-injury, specifically from an HR perspective, where they have identified specific risk factors to do with their workforce or a cohort of their workforce. And those credits are utilized via structured health journeys, which are intended to address those, assessed risk factors. So an example is a fit to work program where you may have a younger population who are not necessarily strong enough from a musculoskeletal perspective to carry out the work of the role. they're put through a structured health journey or a preventative health journey, which is intended to, increase their strength. Similarly, you'll have other cohorts of the workforce, traditionally white collar workers, who see that budget as an ability to actually access services which, they know that they'll utilize, which may or may not be linked to a specific risk factor. For us, the key difference is the model is designed to drive utilization. If someone wants to see a physio for back pain or a psychologist for stress, they can do so quickly, with a practitioner near them. We have a governed national network of about 5,000 practitioners, and appointments are booked in real time through the platform. So when we show availability on our platform, that's, when the practitioner is actually free. And the
Nice.
intention is that actually reduces workplace injuries on the back end, or at least because of our continuity of care model, if an injury occurs, that you can see that same practitioner who treated you, as part of that preventative stage of your health journey.
So you had also mentioned structured well-being journeys. What does that look like for an employee, and why not force everyone into that kind of same pathway?
Well, certainly, different HR teams and different employers we've worked with have done that, where they felt like that everyone can benefit from a stress-related health journey, which is intended to, reduce the overall stress of the workforce. But different departments have different, needs when it comes to their health. What is consistent, though, is that, the idea isn't to prescribe a rigid program. The power of the platform is really intended to give employers and employees, a structured starting point, and help them to find the right practitioner near them to deliver that treatment plan. And, the research supports that kind of strategy. Safe Work Australia published a finding that when you have the same practitioner delivering care, the recovery pathway can reduce from 62 weeks on average to 11 weeks, which is, a massive reduction.
Yeah. Wow.
So,
That's awesome. That's
yeah.
great. Okay. So, and then on the recovery side, how does the insurer linked workflow work from the moment someone enters the system to actually getting booked into care?
So the insurance linked workflow is very similar to, the overall workflows. So the only difference, and it's not necessarily a difference in the sense that it can't be applied upstream, it's just in the way that it's one of the configurable features of our platform, is that when a claim is lodged, the insurer sends an SMS link to the claimant, and that SMS link takes them to a unique page of our platform, which allows the claimant to actually book in treatment. It surfaces the practitioners closest to them with the earliest availability, thus prioritizing, obviously, travel time, making the claimant more likely to go and seek the care of a clinic close to them, but also earliest availability, really prioritizing those practitioners who are able to see the claimant within approximate distance on the same day or next day.
Okay. No, that's great. All right. So you've built a national practitioner network. In your world, what makes a practitioner trusted, and how do you maintain quality across this distributed network?
Yeah, look, we have, I guess, two key ways we manage and rather curate our practitioner network. The first is through our service level agreements with each of our practitioners. That requires the clinic to provide practitioners with availability on our platform within pretty tight timeframes, usually within 24 hours. It also requires interaction and engagement with the platform for things like practitioner onboarding, ensuring that profiles are kept up to date, and ensuring that the integrations with the practitioner's calendar and practice management system are always kept live, and that if for whatever reason that integration fails, it's rectified, within a matter of hours. The second key way that we manage the quality of our practitioner base is through our integrations with APRA, which is the Australian Health Providers Regulation Agency. So we have an API integration with them, which checks each provider's APRA number to ensure that they are still in good standing with the national body. We have other, checks of state-specific databases like CIRA in New South Wales and, requirements in our service level agreements for insurance and reporting and, an ability to ensure that our training and corporate required instructions, from our clients are followed. So we find that the combination of, professional verification, operational standards, and ongoing monitoring is what allows us to really curate and maintain high quality across a large national network.
You had mentioned too about making sure that their profiles are updated. I feel like even in the States, if you're searching, if you go on these networks and whatnot, and you're trying to find a doctor, it's like you don't even know if that doctor's even there anymore or if their profile's been updated. And so I think that's so important to make it easier for the patient trying to get help. And like, give me a profile that's updated. And then what do practitioners like about this model compared with typical consumer acquisition channels?
I think given the type of work that we tend to provide tends to be quote unquote the juicier type of stuff. So, a lot of traditional channels are really targeted at the private client. So the client who will come in as a result of an acute injury. So, I've hurt my back. I want to see a physio near me. So they'll type in Google physio near me or ChatGPT physio near me, and it will surface a list of physios. And in our experience, those clients are usually one and done, sometimes one and, a maximum of 2 follow-ups, but they're not long-term clients or they're not clients with a significant, injury, or they're not going through a significant, preventative health journey which is intended to achieve a specific goal. So, in the example above, we need to get this worker's strength to an acceptable level. Whereas the clients that come through Avaana tend to fall within that latter bucket. So they have a significant injury, which has led to a workers' compensation claim, and that will require, a treatment plan and a pathway of treatment to get them fit and back to work. Or on the preventative side, it's usually, a 6 to 8 treatment client. So and that's all without having to actually spend anything upfront on Google ads or Facebook ads or even to print out brochures. Like you said, all you need to do is make sure your profile is up to date, your calendars are integrated, and we're able to send through this sort of what we think is higher quality clients. And, usually a little bit more challenging and rewarding to the practitioners than, the everyday Australian who hurts his or rolls his ankle while playing soccer with the kids. So yeah, that's kind of the main feedback we've had in terms of, why practitioners like us.
Okay. So you had said psychosocial health keeps coming up in conversations. How is that changing what employers are actually looking for?
I think the easiest way to describe it is that psychosocial health has moved from like a nice to have. You can have like a EAP phone number pinned, on the kitchen notice board, and that was enough. Whereas now, employers, especially under the new regulations, are being asked to demonstrate that they are actively preventing and responding to psychosocial risks like stress, workplace conflict, etc. So what many organizations are realizing that traditional solutions like EAPs often have very low utilization, and that lack of utilization combined with, the requirement to actively prevent doesn't really gel, doesn't really work anymore. And further, employees only tend to actually access EAPs once the situation has already escalated. So what we're finding is that employers are looking for models of care that actually encourage earlier engagement with care. things like counseling, psychology, and importantly, preventative support. So if you understand that your workforce is likely to be at risk, because you work in a particular industry, the goal is to intervene earlier, before issues escalate, and be able to demonstrate that you're actually putting in place the scaffolding to ensure that issues don't escalate into serious health or workplace problems when they, will then obviously find their way into the claim system.
When HR, workplace safety, and finance all have a say, what does that buying conversation usually look like?
Yeah, look, it's not unsurprising, to be honest with you. HR is usually focused on employee attraction, engagement, retention. How do we keep our employees happy? How do we keep our employees healthy? Workplace safety really cares about triage of injuries, early intervention, understanding from the HR team, did we know that this was a pre-existing risk, and has that risk been addressed in any way? Do we know that, this worker, had hearing issues when he's now making a claim for, audio related, injuries? And obviously compliance is the big thing that safety teams look at. Finance is obviously about cost control, and, cost control can be both in terms of absenteeism on the front end, number of claims, cost per claim, total, cost of injury. I won't bore you with the details, but it's obviously cost centric. And what's interesting is that when, those groups come together, they often realize they're solving different parts of the same problem with separate vendors, and, a model that really connects preventative health, early intervention, and recovery can align those priorities, improve outcomes, and reduce disability time in a much better way, an improved way, than if you were requiring each team to really operate in a silo.
Okay, so looking ahead, where do you see the biggest opportunity for this category, say even over the next 12 to 24 months?
Yeah, like I think even over the last week, my thinking around this has changed pretty significantly. I think the biggest opportunity is really being able to bring all the participants and employees' health journey to the one place. And hopefully that place is Avaana. Employees, insurers, and healthcare providers are all trying to improve workforce health outcomes, but, the infrastructure linking them has obviously been very fragmented and left a lot to be desired. Technology platforms like Avaana that can connect preventative health, early intervention, and recovery, in a seamless way, we feel have the potential to really improve employee outcomes, and not just the employee at work, but the employee in all facets of their life. And over the next couple of years, we really see that focus on an integrated workforce health model, which brings all those pieces together rather than treating them as separate services, as really setting the standard for workforces, both from the perspective of improving health outcomes, but also, improving finance and cost outcomes for employers.
This has been great. Kudos to you and Avaana, what you guys are doing over there. Please tell the listeners where they can find you and how they can follow you.
Yeah, definitely. Just avaana.com.au. You can learn a little bit more about Avaana. I'm always available via LinkedIn or email, and happy to have a chat. So thank you, Scott. It's been great being on the Wellness Growth Show, and look forward to keeping in touch.
Absolutely. All righty. Thank you.
Thanks for tuning in to this episode of the Wellness Growth Show. If today's conversation sparks something for you, hit subscribe so you don't miss the stories, strategies, and insights from the front lines of wellness innovation. If you're a founder, operator, or health leader exploring growth into institutional markets and have a story worth telling, I'd love to hear from you. Reach out directly on LinkedIn or YouTube. And if you found this valuable, share it with a peer or post it online. You never know who needs to hear it. Until next time, stay well, keep moving, and keep building what matters.